Good morning and welcome to the webinar, Advantages and Benefits of Self-Funded Health Plans with Stop Loss. I'm Sienna Rodzinski, Membership Director for the South Dakota Retailers Association. Today's program will feature a presentation by Verlin Hahn of Hahn Financial Group Incorporated in Sioux Falls. Verlin is a 30-plus year financial industry executive and the president and co-founder of the Hahn Financial Group, Inc. Hahn Financial Group is a SEC Registered Investment Advisor incorporated in the state of South Dakota and focuses on employer-sponsored group health plans, retirement plans, investment management, as well as general insurance. Just a few housekeeping notes before we start. All the phones are muted of the attendees, so we won't be hearing any background noises. If you have a question, we will have a question and answer period at the end of the presentation. Go ahead and type your question into the chat box that's on the drop down, and we'll read those out loud and get the answers at the end. And finally, this webinar is being recorded, so it'll be available on SDRA's YouTube channel very soon, and the link to that channel is at the bottom of our website at www.sdra.org. Now we'll turn the presentation over to Verlin.
Thank you, Sienna, and thank you for the opportunity to spend the next 30 minutes with all of you. And also thank you for the opportunity to share with you some of the advantages and benefits of self-funded health plans with stop loss. As Sienna mentioned, my name is Verlin Hahn. I am a certified financial planner and one of the owners of the Hahn Financial Group. I have with me today both Luke and Maria, two of our health team members that will also help come time for the questions and answers. The three focal points that I would like to address include, number one, this may very well be one of the more effective ways to influence the cost of healthcare for yourself and for your employees. Number two, this method tends to be a lower cost alternative for most businesses. And number three, the mechanics of a well-built self-funded health plan with stop loss generally provides more employer control over the employer's healthcare plan, which we maintain should be treated as a business within your business. And we work for you. We are your collaborative partner with the SDRA, and we are your personal advisor and quarterback in the process. The Hahn Financial Group is an SEC registered investment advisor. So what does that mean to you as an employer? It means that we are, by definition, fiduciaries, and we bring our fiduciary standards and service model to your health plan. And why a financial advisory firm, and what does that have to do with healthcare? Well, both financial services and group healthcare come down to plan documents and financials. Plan documents drive performance and behavior, while the underlying financials drive the cost and return. The Hahn Financial Group provides self-funded health plans with stop loss, retirement plans, and wealth management. We consider this the health and wealth connection. We serve both small and large employers, both for-profit and nonprofit entities, associations, healthcare providers, and religious entities across the country. This is not our first rodeo. We currently serve more than 1,000 distinct employers across the country. We understand the healthcare crisis, and we relish the opportunity to teach employers how to take control of their healthcare plan. Hahn Financial Group focuses on two items that are rarely heard of in the group healthcare world: fiduciary guidance and fee transparency. Our national footprint allows us to serve employers and employees no matter where your company is domiciled and no matter where your employees live or work. So what are the real problems in the market today? Let's start with 5 issues that drive much of the pain in the market. Can we be more obvious than to start with the healthcare cost? The underlying story is that only 20% of the population accounts for 80% of all healthcare costs. This ratio starts with individuals, but the math extrapolates to employer groups as well. Increasing healthcare costs create tremendous financial tension. Employers pay more, employees pay more, while many times benefits are being reduced. Financial stress is a major cause of employee workplace stress, turnover, causes absenteeism, and lowers the overall productivity of your employees. And further compounding the problem is the question, where is the fee transparency in healthcare today? Costs have gone up, premiums have increased, and yet you never really know what happens to your premium dollars, because many traditional health plans choose to operate in a less than transparent manner. Both employers and employees are kept in the dark. Remember, you must be able to inspect that which you expect. Blind trust is not a good strategy. Which brings us to premium allocation. The Affordable Care Act, ACA for short, has caused a blending of premium costs across the community rating system. Community rating is priced to levelize premiums, not to appropriately distribute premiums. And let me repeat that sentence again. Community rating is priced to levelize premiums, not to appropriately distribute premiums. Therefore, when we peel the onion on how the pricing system really works, we discover that 80% of small group employers pay too much in premium to support the 20% of employers who do not pay enough. The ratios we spoke of earlier hold true. Now, there may be a few employers out there who desire to subsidize other competing employers, but for the vast majority of the employers that we work with under capitalism, the employer's first concern will be, and very well should be, to lower their own costs, increase their own benefits for their own valued employees. Now, that is simple free market capitalism at work. Finally, the issue of profit margins. Insurance companies have desired profit margins, which add to the problem. After all this pain, the insurance company still marks up the whole cost to their desired profit margin level. This increases and stresses the tensions between the desires of the employer, who of course want lower premiums and lower costs, and the desires of the insurance company, who obviously would desire higher premiums, higher margins. But ultimately, the employer and the employees pay more. These 5 issues create a losing proposition for employers and their employees. But there is a strategy that's already used by large companies in the United States that can help combat the problem. Let's start by looking at what really happens to your premium dollars in a traditional, fully insured health plan. This graphic demonstrates that in a fully insured traditional health plan, 100% of your premiums are paid to the insurance company, and you have no control over how your premium dollars are spent. Now, in turn, the insurance company accepts the downside in a high claims year, but also gladly accepts the upside in a low claims year. You have no control over how premiums are spent. But self-funded health plans with stop loss are different. The plans are fee transparent. So you note that the first bucket on the left is an expense bucket to cover all plan administration and risk charges for the reinsurance. The second bucket on the right is the claims bucket. In a low claims year, money left in the second bucket, the claims bucket, belongs to the business, not to the insurance company. Because of the reinsurance portion of the expense bucket, this plan has the look and feel of a fully insured plan with all the benefits of a self-funded plan, largely due to design and fee transparency. Historically, self-funded health plans with stop loss were available only for larger employer groups. Today, we may offer to underwrite groups as small as 5 in all states but New York. In New York, our minimum is still 100. And in 45 states, including South Dakota, we can underwrite all the way down to 2 employees. Self-funding with stop loss is one of the more effective ways employers can influence the rising cost of healthcare coverage. What are the advantages, and what is so special about self-funding health plans with stop-loss? Well, first, the plans tend to be lower in cost. Second, the employer tends to gain more control. And third, ultimate control is financial control over your claims account. The employer retains unused dollars in a low claims year, creating a new business asset. So let's explore these advantages just a little bit deeper. One of the greatest benefits of self-funded health plans with stop-loss is overall lower costs. And you might ask, how? Let's start with the elimination of most of the premium tax. So you see, premium tax is only charged on the reinsurance stop-loss portion of the self-funded plan, a much smaller amount than fully insured plans. The plans also tend to have a lower cost of administration. Third-party administrators tend to operate at lower costs than the insurance company administrators. There's also a limitation of carrier profit margin and risk charges. In a self-funded health plan with stop-loss, the carrier profit and risk charge is limited only to the reinsurance portion, a much smaller part of the total premium. Finally, complete fee transparency and cost disclosures are made available monthly. It is interesting how costs tend to go down when fee transparency is included. When it comes to the health plan for your business, there is a difference between having something done and having it done as well as it should or could be done. So let's talk employer control. The employer also gains much more control. It is important to treat your health plan as a business within your business. And what are some of the controls? Control of plan design options can include low deductible copay plans all the way up to high deductible HSA eligible plans. And you can choose the plan that you need for your business based on what you need to recruit, retain, and reward your valued employees. Control of employer risk. All plans include stop-loss reinsurance that starts where the employer premiums end. This is part of the reason we share that self-funded health plans with stop-loss have the look and feel of a fully insured plan with all the benefits of a self-funded health plan. There are potential plan designs which may include a low or zero copay for generic medications. Now, incidentally, pharmacy medications are a major portion of healthcare costs. A low or zero copay option tends to drive conversations between patients and their doctors to determine if there's a generic alternative available. Provider access can include traditional PPO networks as well as reference-based pricing. And this method allows your employees to work with any willing provider. USA-based customer service is included. There are no offshore service centers where there tends to be an increase in language and thought pattern barriers to the service expectations of your plan participants. But the ultimate control is financial control over your claims account. The employer retains unused dollars in a low claims year. In a high claims year, you get nothing back, but you do not owe anything more than your planned premium. Why? Because of the stop-loss reinsurance. The self-funded health plan with stop-loss becomes your business within your business. Statistically, this business within your business is profitable in most plan years. First, the tendency for lower costs. Next, the tendency to retain unused claim dollars. Therefore, we recommend that, bottom line, if you remember anything, remember that you have options through the SDRA. Get started and take control, because you do have a choice for your healthcare plan. Benefit your employees through potentially lower premiums, potentially better plan design. Benefit your business by taking control of the healthcare business within your business. Remember, self-funding with stop-loss has the look and feel of a fully insured plan with the benefits of a self-funded plan. Contact us or the South Dakota Retailers Association for your own preliminary quote kit. The process is simple and quick, and you owe it to yourself and to your employees to explore the healthcare methods of the largest companies in America and how self-funding with stop-loss may benefit your business and your employees. We love what we do. We love working with the South Dakota Retailers Association, and we would love to help you as employers. Please feel free to contact the SDRA or contact the Hahn Financial Group anytime. We are here to serve you and the South Dakota Retailers Association. Thank you for your time today, and we would be happy to entertain questions.
Great, thank you, Verlin. I do have a couple questions for you. The first question is, can you explain a little bit more about what happens to the dollars in the plan in low and high claims years?
That's a very good question, and I'll start on it, and I also have Luke and Maria here to support me on any portion of this. In a high claims year, as soon as the claims exceed what you have in the claims bucket, even if it's early in the year, the reinsurance kicks in. That is what you're paying for with the reinsurance. But in a low claims year, which is the majority of the time based on the way we design our plans, the dollars that are left at the end of the year are held in a run-out period because some of the doctor and facility bills come in over probably the next 6 months. After that 6-month period, the dollars are available. Now, the employer, these are dollars that are meant to be used for the benefits of the employees. So there are a number of ways those dollars can be used. It can be used to fund some of the future premiums for the employees. It can be used to fund wellness programs. It can be used as additional claims dollars for future claim years. There's a lot of flexibility as long as those dollars are used for the benefit of the employees.
Great. Another question is this a new type of health insurance program, or has this type of program been in existence for a long time?
Well, I've got two answers to that. Number one, self-funding has been around for more than 40 years for the large companies, but it really only became attractive to smaller companies with the advent of the Affordable Care Act. With the Affordable Care Act, companies in our country have tried to develop plans that can help out the smaller employers. The problem has always been the smaller employers don't have the size and the quantity in order to make this cost efficient. But then reinsurers started to understand the miracle of bundling. And if you put enough small employers together, you get the same risk pool as one large employer. So since the Affordable Care Act in 2011, these plans have become more and more popular. Now, one of the things that makes us different is the fact that we have multiple providers, multiple reinsurers, so we can use capitalism to pick the best plan for the particular employer that we're working with. So yes, relatively new to the small business market. I would say it's really the last 8 years or so, but it's been around a long time in the large group market. In fact, if you look at Fortune 500 companies, all Fortune 500 companies self-fund because they understand it is the better way to handle their business within a business.
How soon can I start this health plan?
Luke, would you like to handle that one?
Yeah. We can start any month of the year. We do offer deductible credits for any groups that are mid-year on a current program design so that employees do not need to restart their benefits from joining a new plan. We do firmly believe in capitalism, and if you do have the opportunity to start saving immediately, why not make that change sooner rather than later?
And then what are the average savings?
On average, we tend to come in lower than the fully insured carriers. It really depends on the group we are speaking with, as our rates are the average health of the group that we are looking at. So the average health of the group being enrolled will determine the premium rates. But we do not have some of the factors that are normally involved with the fully insured carriers. We have less premium tax being involved. Our stop loss carrier and reinsurance is only a portion of the overall premium, and with fee transparency, we tend to come in less than the fully insured carriers. Generalized, we can generally say 10 to 20% less, but again, it will be determined by the average health of the group that we are looking at.
And as a numbers guy, if you're looking for proportions, that 80-20 rule I talked about earlier in the presentation holds true in the quotes that we give out to employers. About 80% of the time, we can come in at or lower than their current premiums with the upside of that claims bucket. About 20% of the time we do not, and then they have a safe place in the current community rated system. So 20% of employers I maintain do belong in the community rated system, but 80% of employers may want to consider this as a viable alternative to their current plan.
All right, another question here. How do I determine the health of the group? Is there a medical exam or do employees fill out a health questionnaire?
Luke?
Yes. So part of the process, there's a two-step process to look at how this might look for your group. The first is a preliminary quote. The preliminary quote simply needs basic census information of those employees that are interested in enrolling. And then we assume average health on that initial quote just to see if the employer is interested in looking further. If they are interested in seeing what the quote would actually look like for their group, something that would be bindable and underwritten, we would go towards final underwriting, and that would require health applications to be completed. Within these health applications is where each employee will disclose on a secure and safe either website or paper app, depending on the route that we go with the group. They will disclose that information, and then the underwriters will average all of the applications together and produce underwritten rates. They are not going to exclude coverage for anyone. There are not any pre-existing conditions. Everything is built into the cost of the plan.
I like to consider this back to the future. Prior to the Affordable Care Act, it was very common for us to underwrite. We underwrote all cases. I've been doing this type of work since 1985, and underwriting was just part of our DNA. We lost some of that when the Affordable Care Act came out, but now through the miracle of underwriting, we are able to appropriately price each and every group, because our goal is to find those 80% of groups that are paying too much in their current system, so they might benefit their own business.
Okay. What if I have a $1 million claim in the first month of the health plan? What happens?
That is a great question. We have what's called aggregate accommodations. So the stop loss insurance will be able to start right away. There's the money that was collected for claims funding will be depleted, most likely, unless you're a very large group. But the aggregate accommodation will start right away to make sure that the reinsurance is paying for the claims, and that burden is not placed on the employer, because the employer's only responsibility are the premiums that were agreed upon before the plan started.
And many times the second question to this is, okay, I just had that $1 million claim, maybe that $1 million baby. What's that going to do to our future costs? Luke, you want to talk about the difference between prognosis and diagnosis?
The $1 million baby is a really good example on diagnosis versus prognosis. The initial diagnosis of that difficult pregnancy or difficult birth would be just that. It was difficult. It doesn't tell you how it ended up or where it's going. The prognosis of that situation is generally good, that there's not going to be that $1 million claim coming in again next year. So the prognosis of the situation is good, and the underwriters take that into account come renewal time of the prognosis. Anything that's going well is not as large of a factor for things that are not going well, and it does come back to the average health of the group.
And what I love about underwriting is it's prospective. It doesn't punish you for the past. It looks forward to the future when you're working with self-funded health plans with stop loss.
Okay. One last question. how do employees access their benefits? In other words, do they get an insurance card, or do the healthcare providers submit claims directly to the health insurance company?
This will act and feel like they currently are. They will receive a health insurance card that they will show to the doctor when they come in. They're shown to the front desk when they come in. That will be on file. The third-party administrator information on the back is just like it is with the insurance carriers. They will bill the third-party administrator directly. This is the look and feel of a fully insured plan with the benefits of self-funding. They will receive monthly explanation of benefits also that will show them what the cost of their service was, the discount given by the insurance plan, and then their patient responsibility.
It's a good point. The EOBs come to the participants. There's also great monthly reporting that comes back to the employer, so they know just where their claims account is standing and how that they're looking in their current plan year.
And there is an online portal that employees and employers can log on to see how they're doing, how they're meeting their deductibles, meeting their max out-of-pockets, plan information. And then a couple of our third-party administrators also have phone apps where they're able to access that same information from the comfort of their phone.
And what the beauty of all this technology is why we can afford to offer deductible credit if someone starts with us after being partway through the plan year with another plan. The deductible credit is there and available, and we can still run with the same calendar year deductible. We simply fill in.
Okay. I take that back. One last question. Do employers have to pay a certain percentage of the monthly premium?
In the small group market, that answer is no. They do not have to. Now, it is good practice, we find, for employers to pick up a portion of the premium. What we see in the market, I'm going to start by indicating what I see, and then I'll ask Luke and Maria for any comments. I generally see in the normal South Dakota market an employer share of 50% of the employee-only rates. Now, we also have some employers who are very paternalistic and pay 100% of the employee-only rate. We also have some that are lower, but I would say that the average is at 50% of the employee-only rate. Luke and Maria, anything else on that?
That is exactly what we see, 50% of the employee only, and then if the employee decides on a higher tier of coverage, such as covering the spouse or children or both, that would be their responsibility.
But again, in South Dakota, small groups, there is no required amount that the employer has to contribute.
Okay, wonderful. Well, thank you so much. Thank you, Verlin and Luke and Maria, for today's webinar. I'd like to mention again that if you have additional questions, you can certainly contact our office at 605-224-5050. And just a reminder, we will have this recorded webinar on our YouTube page here shortly. And thank you to everyone for participating in today's program.